Hello, my name is Mackenzie Rosner, and I'm a student nurse at the University of South Alabama, and today I'll be performing the Enema checkoff, so she's going to scan the room first. So upon entering the room, I'll perform hand hygiene, and I will verify the order and hospital policy. I'll identify my patient using two identifiers, so I see this is Jaguar Jones, born on 8/25/1963, 8/25/1963. And I'll assess for any allergies, and I see he's allergic to penicillin. So now I will explain my procedure to the patient and provide as much privacy as possible. And I'll gather all my equipment, making sure that I have my bedpan and my IV pole. So now I'm going to perform hand hygiene and don my goggles. And I'll prep the enema bag. So first I'm going to make sure that my tubing is clamped. And then I will fill my bag with 750 to 1,000 milliliters of warm water or saline for an adult. Making sure that the tubing doesn't touch the inside of the sink. And now I will fill my bag with soap. And then I will gently agitate. And now I will prime my tubing and unclamp. And then reclamp it. And now I will hang my tubing on my IV pole. And now I'll perform hand hygiene and put on clean gloves. Now I will raise the bed to a working height and lower the side rail, and I'll position my patient in left lateral Sims position. So now I will pick up the tubing with my dominant hand. And with my non-dominant hand, I will lubricate the end of the tubing, and I'll place my non-dominant hand on the hip of the patient and encourage the patient to breathe slowly and deeply. Then I will use that hand to spread the buttocks and insert my tubing 3 to 4 inches into the patient's rectum, and I will hold it in there. And if the patient has hemorrhoids, I will encourage the patient to bear down to facilitate the process. So now I will remove the bag, and I will unclamp it and then raise the bag 12 to 18 inches up. And if the patient is cramping or uncomfortable, I will lower the bag and reclamp. But now, so I will, until the bag is empty, hold the bag up 12 to 18 inches. And once the bag is empty, I will remove the tubing gently and slowly, and then I will discard of the enema bag. Now I will encourage the patient to hold the enema for 10 to 15 minutes, and once the patient is ready to evacuate, I will position the bedpan with the bigger part underneath the patient's buttocks or assist them to the commode. And now I'm done, so I will document my procedure, noting for the type or amount and size of the enema, the time, how it was tolerated, and I will note the color and amount of return, and I will also note how the patient was left at the end of the procedure. Thank you.